Okay, so let's talk about another disorder that affects males, which is delayed ejaculation, oftentimes referred to as impaired ejaculation. So earlier we had talked about premature ejaculation, where ejaculation occurs before you're ready. With delayed ejaculation, you can achieve an erection, but no amount of stimulation or amount of time will allow for orgasm or ejaculation. It's another kind of lack of control over ejaculation, sort of like premature ejaculation, but sort of on the other end of the spectrum. Now, it's really important to distinguish this from refractory period, normal, after I just ejaculated, can't ejaculate again kind of effects. So we're talking about a person who hasn't had an ejaculation recently, has an erection, and no amount of stimulation allows for ejaculation. Okay, so what causes this? Luckily, it's pretty rare, but there are psychological causes such as depression or anxiety that can make a person be able to get aroused but not be able to complete. Could be relationship problems. Sometimes when a person is dissatisfied with their partner, they kind of want to, maybe even subconsciously, withhold, final evidence of satisfaction from their partner. Or I had a student once who dragged her poor husband to class and told me that he had this problem. I am not a clinical psychologist and I'm not a sex therapist, so I was not prepared. And plus, it would be completely wrong for me to advise students. This is not at all my role. So as she's telling me the details, they're both students living on student loans. One of their moms lives in the house. I think it was her mom lived in the house with them, and they shared a mutual wall between their bedrooms. My student was ready to start having kids, and her husband didn't think it was time yet since they were both still students. I mean, I am not a clinical psychologist, but I can tell you, it sounds to me like he might have been withholding ejaculation for fear of actually impregnating her. And so I recommended what I will say to you guys, since you know now that I'm not clinical and you should not be telling me stuff. Every college campus has a counseling center, and so that's what I did, was advise them to go see the counselors in the counseling center, and they know how to deal with these things, or how to recommend where you should go. Performance anxiety. Sometimes people who display delayed ejaculation are so concerned about satisfying their partner that they've lost the ability to actually be satisfied themselves. Poor body image. Sometimes a lot of times we stereotypically don't think men have body image problems, but men do. Sometimes they feel like maybe they aren't attractive enough, if they feel like their body isn't right in one way or another. And so they may get inhibited at the last minute and sort of ruin the moment for themselves and lose the ability to ejaculate. If they have cultural or religious taboos about the sexual behavior that they're engaging in, they may not be able to reach completion, because they might be like back in their mind saying, I shouldn't be doing this. And then differences between the fantasies that they've been having and then what is really happening with their partner. And that can be disappointing. And so it can cause inhibition. Biologically, there are neurological things that can cause this. Things like diabetic neuropathy, it's called. So diabetes can interfere with a lot of sexual functioning. If a person's had a stroke or spinal cord damage, it can cause an inability to ejaculate. A urinary tract infection can interfere. Low testosterone or hypothyroidism can cause inability to ejaculate. It might be that they actually are ejaculating, but instead of exiting the body, the ejaculate is dumping into the bladder. If there's ever a failure of the ejaculatory duct, which is its job is to block the bladder and allow semen to exit the body. When it does fail, it never fails on the side of letting urine out. It fails on the side of letting the ejaculate go into the bladder. So you can get what's called retrograde ejaculation. Certain medications can interfere with the sympathetic nervous system and its functioning that would allow for ejaculation. So things like antidepressants, diuretics, which lower water in the body, blood pressure medications, antipsychotics, anti-seizure medicines. These things can interfere with ejaculation. Alcohol also can. Alcohol is not really, a lot of people use alcohol to sort of, they think, make themselves more interested in sex or make sex more fun, but it actually can interfere with a lot of sexual functioning. So, what do we do? Well, psychologically and biologically, let's see, psychologically, you're going to start seeing me getting kind of redundant here. Sensate focus and couples therapy seem to be the best. Again, to sort of get rid of the goal orientation that a lot of times is what's causing ejaculation problems. And then couples therapy, because try and figure out why would you not want to ejaculate with this partner. Biologically, there are medications that you can take that can help. Sometimes things that are normally prescribed for Parkinson's can work for this. Certain allergy medications can help, and antihistamines, and then certain anti-anxiety medications can help. So there are things that can be done. Again, I'm a psychologist, so we mostly think that it's psychological. So now there are some things that affect women. There is not as long of a list. Orgasmic dysfunction is the most common female dysfunction. It's the one that they complain about the most, at least. And it's defined as the inability to experience orgasm. So you can kind of imagine that it's similar in nature to delayed ejaculation, right? For women, they aren't able to reach orgasm. What causes this? Psychologically, depression or anxiety, similar list to the males, right? Relationship problems. We add in here prior sexual abuse. For women, it's been recorded that prior sexual abuse can inhibit sexual responsiveness in general. It's probably true for males also, but it seems to be less pronounced, less tied together. Poor body image, same as males. Cultural or religious taboos. Pregnancy concerns. I kind of alluded to that in my little story I told you about ejaculatory inhibition in males, but for females, a lot of times they can't fully relax if they're concerned that this act might result in pregnancy. And so you got to relax in order to achieve orgasm. And then being under stress, can't clear your mind, can't focus. And so the autonomic nervous system can't do its job. Biologically, there are certain medical conditions like multiple sclerosis, certain kinds of cancer, heart disease, kidney or bladder problems. As I give you these lists of medical conditions, if I always worry that someone will be listening, they'll have the sexual dysfunction and use it as a way to diagnose something else in themselves, something medical. Don't do that. Don't get medical school syndrome. If you think it's possibly tied to something else, then go see your doctor and find out. Low estrogen can interfere with orgasm, and certain medications can. So lots of different things biologically can interfere with hormone patterns and the way that the brain's functioning that can interfere with orgasm. So what are we going to do to treat? Well, a lot of times we focus for women on the psychological really heavily, because for women, it's really difficult to clear off all the stuff that you're worried about and just sort of let yourself go with sex. For men, there's a little less likelihood that they'll have those kinds of problems. A little less. It's not, men are not immune to it, but it's really common for women to have psychological interference. So a lot of sensate focus. Hey, you guys don't even have to have sex. Let's just focus on doing other stuff, and then let's see if you get interested in having sex. Couples therapy, so that you can be brought closer together and deal with problems that maybe have been festering under the surface and that have been interfering. Now, biologically, I put this under biology just because, it's a physical thing to be doing, but a lot of sex therapists use this, guided masturbation. Now, this is an example of a book that a sex therapist might send home with a woman, because like I mentioned before when we talked about sexual behaviors, a lot of times women don't explore their own bodies, and so they don't even know themselves how their body would trigger an orgasm. So a woman who comes to see a sex therapist and says, I have never in my life had an orgasm. I don't even know how to do it. I think I'm broken, they'll say. A lot of times you send them home with a book or a video of what to do and how to do it and an assignment to do it. Like, I expect you by next Wednesday when we see each other again to have done this. A lot of times women will take the homework to task and they'll say, okay, well, I've been given permission. I'm supposed to be doing this. Follow the steps and they discover, oh, either A, I'm not broken, it does work, and now I know where the body parts are and I know what needs to be done. Or, kind of surprisingly, women will say, that's what an orgasm is. Oh, I've been having that all along. I didn't know. So sending them home with a guided masturbation exercise can really help. Kegel exercises. I pronounce them Kegel. Some people call them Kegel. I don't know the doctor after whom they are named, so I'm not sure. Everybody should be doing these, males and females alike. A lot of times we focus just on females because after having babies and things have been stretched out, women will practice their Kegels to sort of get their urethra to not let urine out accidentally and stuff like that. But everybody should be doing Kegels. Kegel exercises, this is a picture of a female, but we all have these same body parts, allow us to exercise our pelvic floor muscles. So what you do is you tighten up the muscles that would allow you to cut off the stream of urine. So you might practice this the next time you're urinating and try and stop the flow of urine and get a sensation of what it takes to do that. And then what you do is practice that several times a day, randomly, whenever you think of it, and tighten up those muscles. And one of the things that that'll do for women is give them more awareness of those pelvic floor muscles. Those pelvic floor muscles will be in better shape so that when they reach orgasm, those pelvic floor muscles can contract harder and produce more sensation so that their orgasms will be more noticeable. Males should do this because not only will their orgasms be more pleasurable but also it gives them better orgasmic control. So everybody should be doing these. Now this sounds doesn't even sound like a treatment, but a lot of times women are non-orgasmic because the lack of lubrication, if they're completely relying on their own secretions to be slippery enough, that stimulation on the genitals without adequate lubrication can actually not be very pleasurable. So adding a lubricant, always go water-based, non-petroleum based if you're going to be using any kind of condom or diaphragm as your birth control method. But and really, you got to watch what kinds of contents are in the lubricants that you don't actually inflame the vagina or penis or things like that. But you add some lubricant and can increase the likelihood of orgasm. Certain kinds of medications can help. Estrogen replacement, you might be thinking, well, that makes sense. You said low estrogen. What might surprise you is androgen therapy, which is basically testosterone. Both males and females rely on a little bit of testosterone. In females, it'll come out of just their adrenal glands. In males, it'll come out of their adrenal glands and their testicles. Both sexes rely on testosterone to provide sex drive. And so a little bit of added androgens for a woman who is having difficulty with sexual functioning, and she may start functioning correctly. And then also antidepressants, which antidepressants can oftentimes have a side effect of making you less interested in sex, but if you're on the correct antidepressant for treating your symptoms, it can actually improve sexual functioning. Okay, let's go ahead and take a break here, and we'll come back and we'll talk about a very special case that only affects women, vaginismus.